Good morning. This is the light. Oh, good. That's in Chicago. You say good morning, and everyone says, nice. So this is the lightning round. Lightning is to inspire. Can't tell a long story. I need to start with disclosures, acknowledge my funders, including the Centers for Medicare and Medicaid Services. The contents of my presentation are my own. Do not hold the government responsible. One of the deliverables of the Healthcare Innovation Award, which I'm going to talk a little bit about, was a sustainable business model, which has made me the founder of a new company called NowPow. Neither the federal government nor my institution endorses, promotes, or supports that entity. So now let's get inspired. And we're down 40 seconds. I'd like to share with you some ideas about engineering solutions to injustice. This is what my lab does at the University of Chicago, and I think this is a tie that binds me to many of you. CommunityRx is the project that the Healthcare Innovation Award supported. And the idea of CommunityRx is to connect healthcare, the business of healthcare, the workflow of healthcare, to self-care. We spend most of our time taking care of ourselves, not in the doctor's office. So how do we connect the two? First, we have to start by quantifying the injustice that bothers us. We have to do it in simple terms that everyone can understand. There is a lot of talk about health disparities, but there's a mortality gap that is shameful and shocking in the richest cities, not only in our country, but in the world. And this is, to me, the quickest, easiest way to talk about the problem we're trying to solve. In Chicago, a neighbor, somebody I can see out the window of my lab, can expect to live 69 years, 16 fewer years of life than somebody who lives 8 miles away. And this is not just a Chicago problem, it's a New York problem, it's a Baltimore problem, it's the problem that we're talking about when we talk about health disparities. This is the injustice that we should be angry about, it should get our attention, but this is a deficit-based view of what our potential is. And to engineer solutions to injustice, we must work from the assets. We can only leverage assets if we know where they are. And that's what MAPSCORE is about. When we engaged with a whole variety of stakeholders across sectors on the south side of Chicago, and we said the University of Chicago has some tools of science that we'd like to bring to you to help envision a new future for health and vitality in our communities. Community leaders said, engage youth. If you want us to work with you, you better figure out a way to engage youth in everything you do, which is the most brilliant piece of advice we got. Meaningful, active, productive science and service to community. That's what MAPSCORE means. And these youth are employed every single summer, paired up with college students, walk feet on the street every block of now 110 square miles in Chicago, all of Harlem and the Bronx this summer. And they bear witness to and they collect the data on what are the assets of the community. What are the businesses and organizations that are open and operating to serve the public in what would otherwise appear to be broken communities. These youth are the future scientists, and the vision of MAPSCORE is to cultivate scientific minds, healthy people, and invested citizens from the assets of our communities, not in spite of the deficits. And they produce the highest quality data that everybody can use to improve the human condition. Why do we need to do this? Why do we need youth to map assets? Can't we just Google it? Well, if we rely on the best available data, if we look at the visible assets, what we see is that we're missing something. The assets discovered by MAPSCORE above and beyond what was visible, I don't know where to point this, 50 more, 35 more, overall 646 more. This was in the early days when we were mapping a smaller geography. But if we rely on the visible assets, it's only 64% sensitive in the health sector or 72% sensitive in the human services sector for what's actually there. So I, as a physician trying to refer my patients for social services, don't have the full picture, and that's wasteful. So we need to cultivate citizen scientists and health-conscious people, and again, youth are the place to start because they're the future of our communities. What happens when our data produce findings like this? And I know that the words are small, forgive me, but let's just say that we have more than 180 Christian churches per 100,000 population in our communities. Let's say we observe that we have as many liquor stores as we do primary care clinics. Let's say we have twice as many dialysis clinics as we have weight loss centers in a community where morbid obesity is upwards of 30%. These are important data, and I as a physician can be one voice around this, but what if youth are the voice? The youth collect the data, the youth analyze the data, the youth are the voice around the solutions to the problems. That tells a different story and it moves the needle in a different way. So then we have to align the solution that we engineer with community values, with the local culture. And in our culture, community leaders said, if we're going to try to narrow the gap in mortality, if we're going to try to lift up health and reduce suffering, the data we collect must be available to everybody. And so the data from year 1 in 2009 and every year since goes to mapscore.org, where everyone can use it. You want the database behind the data? Call us and we'll send it to you. Physicians needed a way to connect to the data about the resources of the community day to day in our workflow. Not another website we go to, not an app we pull out on our phone, built into the electronic medical record system. And this is doable because we do this with e-prescribing of drugs, which is what drove electronic medical record adoption. So if we can prescribe drugs, which account for an important part of our health, but a small part, then why can't we prescribe everything else? So this is what CommunityRx attempted. We employ youth to generate the asset data. 50%, it's their first paid job ever. The data are linked to EMRs, Epic, GE Centricity, NextGen, operational in 33 sites on the south side of Chicago. Patients receive a customized printout of the resources relevant for their needs. They use the community resources because now they know they're there. Businesses, nonprofits thrive because people are using their services. And then there are more assets for the youth to map. This is collective social impact, and this is what CommunityRx is about. I want to end on one thought. Ralph Ellison, the great American author, wrote a book called Invisible Man. Invisible is what we cannot see because of the physical limitations of our eyes. We need a microscope, a telescope, an MRI. Invisible is what we choose not to see because we don't want to look down there. We have biases, we have prejudices. And in order to engineer effective and sustainable solutions to injustice, we must push ourselves deliberately and consciously as engineers to see the invisible. Thank you.